Not covered, the term is on every explanation of benefit your insurance sends you. What is it? What does it mean? And are there tips to help you along? Welcome, I am your medical bill whisperer. I am a previous billing manager turned patient advocate. So look at any EOB you receive. There will always be a not covered category listed under patient responsibility. What does it mean? Well, it could mean that it is not a benefit that is payable under the terms of your policy. There could be many reasons for that. It could be an exclusion per your policy, something outside the scope of your coverage, for example, dental services on a medical insurance plan. It could be a specific exclusion, for example, chiropractic or acupuncture services. It could be a number limit, for example, anything over 12 sessions of physical therapy per year. But it could also mean that the service is considered experimental, investigational, or off-label. It would mean that it is not appropriate, safe, or effective clinically. It could be that the service has not been approved by the FDA or not considered to be standard of care. Of course, it could also mean that your doctor's office has not provided the insurance company with requested medical records. Not covered could also mean not covered under certain circumstances. For example, if there is a coding error, a procedure code and a diagnosis code do not match. It could be that no authorization was obtained when it should have, but also that there is a dollar limit on payment, for example, $500 top for any kind of ambulance service. Certain preventive services like colonoscopies or mammograms are limited to a certain minimum age or to a certain number per year or per a number of years. If you exceed that or do not meet the requirements for coverage, it will be not covered. Some plans are limited geographically, meaning only services rendered in your state of residence are covered, not in any other state or abroad. But the main reason you would see some numbers listed under this not covered section of your EOB, and that if claims are out of network. And whatever portion of a billed amount is deemed by your insurance to be too high will be rejected as not covered. So what does it mean for you and your wallet? Well, services that are rendered in network should show a $0 amount under not covered. Why? Because the difference between what is billed by the medical provider and the allowance that your insurance indicates on that EOB is a write-off for the provider. It's a discount for you. You do not owe it. The allowance has been accepted as payment in full by the medical provider, and therefore there is nothing not covered. The issue comes when a claim is out of network. The difference between the amount billed by the provider and what the insurance allows, that becomes not covered. EOB will then show a certain number of dollars, which are the difference between that amount billed and what the insurance considers a fair price for the service, also called the allowance. That not covered amount is your responsibility. And if your insurance pays nothing, but let's say applies a small amount of the amount billed towards your out-of-network share of cost, such as deductible, then the full amount billed becomes your responsibility. In this example, $450 were billed. The insurance only allowed $49.20. and applied some to your copay and the rest to not covered. So the difference between the amount billed, $450, minus what was paid, $29.52, is your total cost, $420.48, of which 480 cents is considered not covered. And to make things a little bit worse, you will only get credited for the allowance of $49.20, not $420.48, which you owe the doctor. The full services not rendered amount of $400.80 does not get credited towards your yearly liability or share of cost. And this is one of the main reasons why it is so hard to meet your out-of-network liability maximum in a year when so little is credited towards it, and yet you end up paying most, if not all, of the billed amounts. So can you do something about it? Yes, you can. If an EOB shows a not payable due to a coding error by the provider, all they need to do is correct it and resubmit a corrected claim. If the insurance has made a processing error, and trust me, that happens all the time, calling your insurance could get it corrected on the phone. If not, you may need to file an appeal. If a service, a treatment, is considered not covered because it's experimental, investigational, or off-label, my question to you is, did you receive prior notification that the service or treatment was not expected to be covered? What was then the expected cost? And asking you to sign on going ahead. If you have had no such notification, I would strongly suggest to contact the doctor's office and ask them why not. Is there clinical, legal, or other evidence that could justify the service? And in that case, either you or the office must file an appeal. But if the insurance made a mistake, you point out that the medical policy they used is out of date, but something previously off-label or experimental has now been FDA approved or is listed in a compendia or in journals and trials that show that it is safe and effective clinically. If you do, or if the office does, an appeal might be in order. If something has been deemed not payable because it is not a benefit under the policy or is listed as an exclusion, is there again clinical, legal, or other evidence to override or extend that policy? And I'm thinking, for example, of the No Surprise Act, the federal law that forces insurance companies to extend their coverage under certain circumstances, especially emergency. Some states, such as California, also have state laws that force extended coverage or beyond the terms of policy under certain circumstances. For example, out-of-network services rendered at an in-network facility. If your plan is self-funded, meaning your employer decides on the terms of coverage, I would suggest contacting upper management or HR and ask for an exception. And if your plan is administered by your state of residence, you can always request an extension or an exception to a policy, as long as you have supporting evidence and documentation. For example, if services out of state are not covered, but the only surgeon capable to do a specific procedure is out of state, you can obtain an exception and those services will be covered. Same if you cannot find any in-network provider in state that has the training, expertise, experience, availability, or if you are referred out of state in order to save your life or your health, you can request and obtain an extension or exception to the terms of policy. And if you don't ask, you cannot get. So ask. I so thank you for watching. I have other videos listed below that can help you understand some more of the terms used here and help guide you to get those not covered services paid for, as they probably should. Thank you.